municipality in Ontario. That's okay, except for that of First Nations communities where it is optional. The work is carried out through collective impact and collaboration with a multitude of community partners, which I will share more about with you shortly. We are currently working within the second iteration of our plan here locally and planning to prepare the next version in alignment with the municipal election next fall. So collective impact. As members of Rotary, I don't need to tell you folks too much about the value of working collaboratively with your community partners. You understand that. So I'm not going to explain that piece to you. I will highlight here that the success of our community safety and well-being plan and the work being carried out relies on the successful and respectful relationships with community partners, including the OPP, the nonprofit and social service sector agencies, the school board, and more. This will probably make you dizzy if you try to read them all. But to give you a taste, there's currently 41 partners involved in our community safety and well-being plan. I've made a concerted effort the past 11 months to ensure that as many agencies serving us locally are at the table in one way or the other. So we know we have a lot of Hastings and Prince Edward agencies that aren't located here, but provide services to residents. So we make sure that those folks are at the table as well. Some of these partners listed here, including Community Care for Seniors, have been part of the Community Safety and Wellbeing Plan since its inception and continue to play a very active role in a variety of ways. I like to share that Laura McGugan of Community Care is my right arm, because if I need to be hooked up to somebody new, Laura seems to be connected to them and makes the introduction, and then we've got another partner at the table. So I really appreciate the enthusiasm of community partners like that. Our current iteration of the plan focuses on 5 priority areas that were identified by the folks who worked to establish the 2022 version. I will note that that did take place over COVID, so it was entirely done virtually amidst all of the challenges the pandemic threw at us. Those 5 priority areas are listed here: domestic, sexual, and intimate partner violence, housing and homelessness, senior support, mental health and problematic substance use, and poverty reduction. So each priority area has its own action team comprised of staff from local organizations and representation from the OPP. With their expertise supported by strategies outlined in the plan, these agencies come together to identify ways to prevent or address existing challenges and concerns as it pertains to the priority area they participate in. Some agencies are represented at more than one action team table, depending on their mandate. One of the neat and new developments is the enthusiasm of participating partners has also developed new areas of focus within the priorities. So for example, our mental health and problematic substance use action team heard former Staff Sergeant, John Hatch report to council about the issue of impaired driving in our community, and that the percentage is actually significantly higher as residents versus people from away, despite the rumor otherwise. And so this action team decided that they wanted to look at reigniting a partnership with Mad Quinty, which I'll talk more about in a moment. But that's not laid out in the plan anywhere. That's just something that's developed grassroots and organically. So I'll give you an idea of the types of projects currently being carried out, or those have been carried out in the past year within each of the action teams. For housing and homelessness, they're currently producing a housing education video series. So my colleagues in the housing department were formerly hosting and still host in-person education series. So for landlords and tenants, information on their rights, their responsibilities, and they were finding there wasn't a big uptake in in-person attendance, partly because the information is quite personal. And there are lots of folks who weren't necessarily comfortable to be in a space identifying that they were having a challenge with their landlord or needing that kind of support. And so this action team took some of their budget money and are developing an education series that's going to be available online through the municipal website. So it'll feature a lot of the same content. It'll also directly link people to staff members so they can have a one-on-one conversation, but they get to do it in the privacy of their own home versus showing up at the town hall. Additionally, this action team has led a data collection and dashboard display in partnership with our dear friend, Anne Van Vlack, the Vital Signs Coordinator with the County Foundation. And this ensures that information specific to our community is available to residents, enhancing the validity of the work within the Community Safety and Wellbeing Plan. The Senior Support Action Team has worked on a few things in the last year. The New Horizons Seniors Advisory Group was selected from residents who applied to be part of this group. They were educated on the work that's being done within the Community Safety Wellbeing Plan and provided a recommendations report as it pertains to senior-specific issues and how they could be addressed at the municipal level moving forward. This group also led a pedestrian safety campaign supported by the Ministry of Transportation. And so they created and distributed education materials in the form of rack cards and partnered with the library to give away 1,500 reflective items for folks who were walking on the roadway and maybe were walking in black or dark. They could pick up free items from the library. So that was a huge success. And ongoing, the municipality supports the active living funding at Community Care for Seniors, the active living program. And so that funding maintains now to the duration of council. Currently, this team, we took a break in July and August meeting, but I'll meet with these folks tomorrow. They're currently looking at a community fraud awareness campaign and partnering with 99.3 County FM to enhance the education materials that already exist, but really make it a community focus as opposed to just seniors. They want to be able to kind of launch how other people in different demographics are affected and making sure that everybody's supported. This is a real exciting one for me, the Poverty Reduction Action Team. So in April, we hosted 4 community conversations across the county, appealing to residents to come and share about what they see are being the issues related to poverty in our community. It may or may not surprise you that a lot of those folks that showed up to the table didn't think that we had a poverty issue in Prince Edward County. Ours is not as evident on the streets like it would be in the city of Toronto. And so I've met lots of folks whose eyes have been opened in understanding that we have folks living in the shadows here. We have a number of families living in deep poverty in different pockets throughout the island. So these conversations will continue and have sparked some a couple of things. One of those being the Food Collective was revitalized in 2021. So that's a number of agencies coming to the table that provide food programs and services, and they're working, again, collaboratively to look at how we can address food insecurity in our community. And also we heard about the need for a community cell phone drive. So we're titled it the Callback Project. And the idea here will be early this fall, we'll appeal to the community and ask residents to donate their gently used iPhones that they're no longer making use of. So we can have them refurbished and factory reset, and along with a SIM card and a charger, be distributed through our social service agency partners to folks in need. This connects them to employment opportunities, healthcare appointments, and to their loved ones. So that was identified as something that would be of value through those community conversations. I'm also very excited to share that we are going to be hosting a Bridges Out of Poverty community-wide training. That's never been done in Canada. And thankfully, my bosses like big ideas, and so it's happening. So that's going to take place October 28th, and that's for all people in Prince Edward County, residents and social service agencies alike. And it's about finding a common language in how we look at poverty in our community, how we work with each other and approach each other and provide the best level of support. So the idea here, we polled a number of people. They said they wanted it during a weekday, during the daytime. We know that's not going to work for everybody, but that's where we're starting. And the idea would be that we would have a Bridges Out of Poverty 2.0 sometime in 2026. The Mental Health and Problematic Substance Use Action Team, I mentioned that they've launched the Mothers Against Drunk Driving Quinte chapter partnership. So that's been great. We've had folks from that table visit farmers markets this summer to really educate people in our community, visitors and residents, about the dangers of impaired driving. Additionally, we're working with the OPP to look at MAD Canada's top 10 municipal measures, which ironically was a report that came out in May, just as this group decided this needed to be a focus. And it gives us a checklist as the municipality to enforce as many of these pieces as possible to ensure we're protecting residents. We're working right now on getting the Canadian Mental Health Association drop-in back into the county. That's a service that hasn't existed here in a while, and we desperately need it. So this group is working on launching that. And a very exciting initiative, a youth mental health resource fair, hopefully in partnership with PECI. Don't quote me, I meet with them next Monday, but I'll give you more information and details on that in a minute. And lastly, the Domestic, Intimate Partner, and Sexual Violence Action Team have been doing a plethora of things, including a survivor forum. So they, in a safe space, invited victims of domestic violence to a table with the OPP and partner agencies that provided support to hear about victims' experience in navigating that system and provide feedback on how those services could be altered to be kinder and more respectful. They also relaunched the Red Card. So formerly there was a little booklet that victims of domestic violence would receive, and it gave a list of all of the resources in Hastings and Prince Edward that are available to support them. This group decided that something a bit more discreet and something with a purpose, like a keychain with a QR code, would be more appropriate. And so we've launched hundreds of those throughout the community as well. Currently, they're working on a survivor journey survey. So secondary to the survivor forum, this is a more enhanced way of getting feedback from survivors of domestic violence and applying it to service navigation and that sort of thing. So lastly, what can you do? I really appreciate this opportunity to be able to share with you. I'd love for you to reach out, email, or call me and set up a coffee date. I will chat with you. I'll chat with your friends, your neighbors, your book club, anybody that you think might be interested in learning about the Community Safety Wellbeing Plan, the work that's being done, how you might be able to get involved. And also we'll be working towards the next iteration. So over the next year and a bit, there will be lots of community engagement. I really want to see residents who aren't necessarily connected to a social service agency or a nonprofit, but just care deeply about their community. I'd like to hear from those folks and have them identify where they see the priorities being. And I believe that is all for me, unless there are any questions.